Hey everybody, it's Oliver Libby. Welcome to the next episode of Frontlines Corner. And today is one of the days where we get to welcome a guest. So I am delighted to introduce Deepanita Das, or Dee as we call her, who is co-founder and CEO of Sorcero. We are very happy to be investors for a long time and many times over in this very exciting company. And I asked Dee to join me today because we've been hearing and talking a lot about AI. And obviously there's a lot of hype around it, and there's a lot of promise and a lot of risk. And Sorcero is deploying AI in a really sophisticated way in one of the most delicate and important areas in the world, which is healthcare and the lives of humans. And so I thought, what better person to ask to join us today than Dee to help us think through the hype around AI and how it is actually going to affect lives. So without further ado, Dee, thank you and welcome to our little Frontlines Corner here. I think maybe it would be good for our audience just to get to know you a little bit. Can you talk a little bit about Sorcero and your journey in founding it?
Sure. Thank you, Oliver. It's always a pleasure to be talking with you, and ever grateful and delighted to have partnered with you for as long as we have. I'm Deepanita Das. I'm the CEO and co-founder of Sorcero, and our company is built on a very simple premise, which is that the insights to improve patient lives exist. We just can't access them at the speed or the scale required. And in healthcare and in life sciences, wasted time means wasted lives. And there are several reasons for this. First and foremost, this is because medical decision makers are indeed drowning in an ocean of information. Scientific content is growing at a 43% CAGR. It has far surpassed what any number of human beings can sift through, analyze, and take decisions on the basis of. Interestingly, I first encountered this need while I was building digital scientific platforms for the world's largest public health campaign. Turning research into messages that can motivate the public and regulators to take effective action in 20 different countries was quite hard, and I needed tools to make it faster and easier and more repeatable and more scalable. I found that these tools did not exist. So I built Sorcero with my co-founders, Walter and Richard, combining both cutting-edge AI and decades of public health learning on listening and communicating in a patient-centric way. In the end, I found that those who need this the most were medical affairs teams, just sort of the product management / customer success teams within the pharmaceutical industries, the manufacturers of these products, who are really striving to improve patient outcomes across the world. And they're doing it without the best-in-class tools to be able to do it effectively.
Awesome. And for those who are frequent followers of our Frontlines Corner here, note that Dee's background spans sectors, which is something we think is really exciting and has really informed the wisdom that she has brought to Sorcero. So speaking of that wisdom, I think it's pretty simple and obvious to say that we're in the middle of an AI hype cycle, and that there's a lot of excitement around what AI can do, a lot of concern about what it maybe shouldn't do, and particularly just a lot of excitement about AI in general. I mean, the joke is that if you can just put AI in front of anything right now, it'll get funded and it'll grow quickly and it's awesome. But I think that there is, as there always is in these kind of trends, a big difference, a delta between what's real and what's fake. And it's very easy to just slap a moniker on something. I mean, forever we've heard machine learning, AI, and all that. The question I want to ask you is, especially as you think about the technology and the depth of what you've built, what is the difference between real AI and kind of fake window dressing AI? And how does this factor into the current hype or trend cycle that we're experiencing?
So Oliver, that's a great question, and one that we think about a lot and we talk to our customers about a lot. And I think the optimism and the skepticism are both merited. The way I think about AI is, what business problems can it solve today? In fact, what problems can it solve today? Not just once, not just in a paper, not just in a prototype, but repeatably, scalably, dependably, where if it is indeed changing serious outcomes at the end of the day, we can be confident that we won't have to roll those changes back. And that's really where the rubber meets the road. what I am finding is that there are a couple of places where we can use several different approaches to AI. As you know, Gen AI is by no means the only approach to using AI effectively to solve business problems. I think there are a couple of places it does well. One is it does do well in computing large volumes of information, particularly if you can tune it and deploy it against unstructured content, which is how the world runs. So you can indeed, for the first time, reliably take a body of research, take a body of medical information, take a large volume of scientific data and make sense of it. And by make sense of it, there are three ways our customers, for example, like to make sense of it. First, tell me what's in it. Just tell me what's in it, not tell me what's important. Just tell me what's in it, because they have so much of it, they don't even know what's in it. Number two, tell me what I should know from it that is important for my business, for my customers, for my product. And it can do a pretty good job as well. And I think the third part is actually generating accessible content. One of the things about a lot of these generative models is tone. It's very casual, it's very personable, it's not scientific writing, it's not exactly literature. And that lends well to taking complex topics and translating them in a more relatable, patient-centric, layman way. And I think in these three areas, we're going to see a ton of progress. And I'm particularly obviously talking about content because that's my world. But in the world of structured data and numbers, you can expect that it's gone a lot further.
So obviously, we have experienced in just the last few days, even some pretty big news about valuations for companies like OpenAI and not far behind them, or Anthropic and others. There's a little bit of a train leaving station feeling there. Do you think people kind of missed out on their chance to get involved in the AI revolution as investors, as employees, et cetera, if they sat out the last year or two, or is this going to be kind of a longer process?
I think it's just getting started. We might have gotten a handle on the foundation layers because you are talking about incredible companies that are building foundation models. But the real revolution starts when you use those models to solve problems, to transform the world around you, to actually change how businesses operate, how patients are cared for, how everything is done. And I think that is really where the money, the opportunity, the ability to get involved with true transformation begins. So I am excited about what is to come. And infrastructure will always be valuable, but let's not be too skeptical about the kind of enterprise value of applications and workflows and actually creating spaces where people do their work can do for both people who want to join or build things and the people who want to invest in those companies.
Yeah, it strikes me that's a little bit like arguing that, if you didn't invest in Amazon, then there was no marketplace ever that was the last marketplace, or that Google was the last time, and then search ever was innovated, or this ecosystem of investments and opportunities to sit atop of those things. So I agree with you right at the beginning. Just before my last question, I don't want to let you off the hook on one thing, which is I think perhaps the very public and perhaps concerningly wide releases of some of these technologies has yielded some knowledge and even some caveats, like hallucination, for example. How does a company like Sorcero stay ahead of that? Have you kind of built for that?
The short answer is yes. We decided at the very beginning that we were going to work with the world of scientific content. So we knew that security, explainability, transparency were going to be foundational to how we bring our AI services to life, how we power product features, and eventually how we earn the trust of our customers forever. So yes, to take on a specific issue of hallucination, we've seen certainly some very, very fun hallucinations in our experiments, and maybe that's for a later day. We should have those. But what we do now is we have a layer of data. We have a base of data. So what we do is when, let's say, we're generating something, in our case, we often generate plain language summaries of scientific documents so that patients can understand. Or a physician can read it faster. So when we do that, we also analyze what we have generated and compare it to the original and highlight possible hallucinations. It could be a made-up name, a made-up concept, one of our generation said, "Hey fella," to put it simply, was the tone. So, you need to kind of correct for that. You don't want to be quite as familiar. So one way is to have a system that can do that grounding and that can highlight it so that a human editor, when they're reviewing that before they publish it, can check off on it. But there are some simpler ways to do that. It gets complex as you get bigger, as you handle bigger volumes of information. But there is always a human expert in the loop because we are dealing with scientific exchange between an expert and another expert. So we certainly cannot introduce rubbish in that analysis.
I can't wait until I can tell the AIs that I work with to address me in certain tones, because mine is definitely going to be Yoda. Like, I just want it to talk back to me in Yoda. So let's close out on maybe the most kind of human question in all this, which is, we do risk getting very cerebral about these things. These are very complicated, particularly the kinds of markets that you're serving and the companies you're serving. There is a risk that it gets, really in the clouds and really technical, and that it kind of separates from the human experience a little bit. And I think that's true of a lot. In fact, a lot of people are concerned that on a human level, what AI is simply going to mean for them is less work or being disintermediated from things that they think are interesting, or essentially being in some other way concerning. And so what I want to close on here is kind of bringing this down to the real world good that AI can do when it's used, deployed, and created in the right way. And Sorcero's mission is certainly that. Can you share with us what Sorcero's AI and technologies like it are going to mean for individual people if they're done right?
Absolutely. Sorcero was started because we are all patients. And because everybody we love gets sick and goes to the doctor, and sometimes they don't come back. And for us and for them, we want to make sure that when they're in front of their physician, they can operate with the assurance that that person, their caregiver, is fully armed with all the information they need to know about the patient, but also about every treatment out there that could potentially improve their lives. But that knowledge exchange, that ability for that provider to know everything, isn't just about the provider. It's about the systems that support the provider. So what Sorcero has chosen to do in service of patient lives is to make sure that the infrastructure that supports the provider making the right decisions, knowing everything they need to know, that is in great shape. And so when we support our customers in amassing and collecting and analyzing and in communicating all of the data that governs the use and safety and efficacy of their products, we're supporting a physician in the end who hopefully will be able to save your life or that of someone you love.
Well, I think that's a great note to end on. I can't resist, because I know you and I are both sci-fi fans, to point out that even in the wonderful future painted for us by Gene Roddenberry in Star Trek, there's not no doctors on the Starship Enterprise, but there are very few, and then they have a powerful computer and a tricorder behind them, and hopefully that's what we're building in Sorcero. So Dee, thank you for sharing your insights and knowledge with us. Keep at 'em on Sorcero. We can't wait to see what's to come, and check back in this space to learn more. Thanks everybody for joining us, and thank you again, Dee.
Thank you, Oliver.